Hello and welcome to the July video. Though COVID has been around for 3 months, it feels like time has almost stood still. But now we're starting to see a light at the end of the tunnel, and we want to spend a few minutes talking with you about what our experiences were these last 3 months, what we've learned, and how we're planning for the future. So to that end, I want to talk with 3 leaders in our organization about what their unique situations were and how they've adapted. I'm here now with George DERATANY, Vice President of Laboratory Services, responsible for the COVID testing. George, tell us, what was the critical situation that you dealt with in the last 3 months?
So the laboratory became very stressful very quickly. We had to assess a laboratory that could perform COVID testing very quickly. We had to assess the instrumentation that we had in-house that could perform testing, as well as look at the number of supplies that we had in-house to be able to provide to our offices and to the hospitals.
So that was a real shortage area across the country. And did you experience any fundamental shortages?
There was shortages with all our companies that we work with for purchasing supplies. We also partnered with Corning Inc. that was able to produce supplies for us and work with partners that they had that we didn't have and bring in more supplies for us.
So what did you learn from this?
We learned to be very flexible as a laboratory. We had to follow guidances that were changing daily and even hourly from New York, Pennsylvania, CLIA, CAP, and Joint Commission, and we had to change based on those collection suggestions, guidelines, as well as the testing guidelines.
When you look forward, what will you learn from this that you're going to do differently in the next months and years?
What we have done is we've purchased additional instrumentation that will allow us to continue testing COVID tests on a more readily basis for the hospitals and for our Guthrie offices. That will also increase our testing capability, as well as looking for other companies that have the most current instrumentation and testing available that will be good partners for us, and we'll be able to work with the community and provide services that we need to for our communities.
Super. Thank you very much.
Thank you.
So now we're here with Donnie SKERPON, our Administrative Chief of Staff, and someone who pitched in the area of supplies during the last 3 months. Donnie, tell us, what was the critical situation that you were dealing with or helping with in these last 3 months?
Well, the national supply chain was completely disrupted at this point in time, and given that the majority of the PPE, personal protective equipment, which was really the primary area of issue, was manufactured in China, where we first saw evidence of this virus, the supply chain was completely constrained. And that was further compounded by the fact that we rolled into this period of time after having a recall of surgical gowns by our supplier. So we were in a situation where we had limited supply in key resource areas for our services. Given
that experience, what did we learn from this, and what would we do different?
First and foremost, we learned that we had an extremely supportive community with the national attention to the supply chain issues. We had community organizations and members come forward with generous donations in areas of really gowns and masks and other supplies to help our organization get through this difficult period of time. Second, we recognized that we needed a diversified supply chain. We found that focus on individual suppliers presented some challenges related to getting the types of supplies that we needed. So we needed to get diversified so that we had more alternate sources in order to meet the needs that we had. And third, we determined that we really need an effective emergency stockpile. We need to make sure that we have enough supplies in front of us to meet the demands of the organization for a few months at least in front of us.
So it sounds like we've got some new and different plans for the future. Anything else you want to add?
Yeah, I would say that one is we have a very dedicated supply team. We've gotten through this entire period really without disrupting our recovery plan, which is quite amazing given the challenges that the national scene has indicated.
So, and lastly, I'm here with David Hall, who's our Associate VP for Operations, and in particular has been the focal point for developing our telemedicine projects. So David, tell us, what was the critical situation that you dealt with in these last 3 months?
Well, our critical situation had to deal with developing a new approach to delivering care in a crisis. So we had to quickly turn around a training program and bring over 400 providers live on telehealth capabilities to ensure that we continue to offer care to our patients with their safety in mind.
Very good. So you went from how many telehealth visits per week to what?
So we went from actually about 40 per month to in April we completed just over 13,000 per month. Since April in our post-COVID era, we have continued to see anywhere from 3 to 5% of our total ambulatory volume as telehealth, which averages out to about 130 to 150 patients per day.
Wow, that's great. So as you went through this transition, what did you learn? What did we do differently?
So we definitely learned that the organization has the flexibility to shift very quickly in a crisis state. We were able to work with our colleagues across multiple entities to develop a well-rounded training program for our providers with our patient safety in mind. We also learned that the patients have a vast array of technology capabilities. Some are very good using technology, some are not very good. So we have to be prepared to address both ends of the spectrum for these patients to ensure that they are getting the care they need.
Lastly, do you see anything different for the future that you wanted to comment on?
I do. I think telemedicine is here to stay. I think it's going to be a part of our everyday business. I think patients are starting to get comfortable with the idea of technology. I think our physicians and our APPs are comfortable with the technology. As we move into the future, it's going to be based on the appropriateness of care in which patients were appropriate for telehealth encounters.
So while we don't know what the future holds, whether there'll be another wave of COVID-19 or not, I think we can feel confident that the organization responded really well to a crisis that was both severe and urgent, and that we've learned some very good lessons. And these are lessons that we can apply now and into the future, both in our routine care and if another crisis comes. So I want to thank each and every one of you for all the great work that you've done in these last 3 months helping us and our community get through this critical time. Thank you very much.